Inis ceist ochtus seacht agus Donnchadh Ó Laoghaire.
Minister, and this is your first time, I think, probably debating this particular matter. The issue of the potential adverse health outcomes for former aircraft maintenance personnel with the Air Corps is something that has been discussed a lot over the years. An awful lot of people who served in aircraft maintenance, they believe that many people have suffered very severe health outcomes, including untimely deaths, because of exposure to dangerous chemicals. I want to know what you're going to do about that in relation to the category generally, not individual cases.
Thank you, Deputy. And again, as it's my first time answering a question on this matter as Minister for Defence, I do want to take this opportunity at the outset to say the health and well-being of the men and women of Ólaigh na hÉireann is of the utmost importance. In fact, it's paramount and it's front and centre in everything that we do, as it is, I know, to the Chief of Staff and to the Secretary-General, Jacqueline, from the Department. Very clear in my view as Minister that those who serve the state with such professionalism and integrity should be able to do so in what is a modern and well-equipped defence forces, that is also a safe place to work, as all places should be. And in that regard, as I mentioned previously, I announced a substantial investment of €1.7 billion in the Defence Forces over the next 4 years. It's not just about technology and equipment, new naval vessels and otherwise. There's an investment specifically in the men and women, their equipment, that they use on a day-to-day basis. It's really important that we're investing in them directly and ensuring that they're working in safe spaces. I want to acknowledge Deputy O'Leary's ongoing commitment to this issue in particular, and I know and I'm aware that further to an offer made to you by my predecessor, by the Taoiseach in this House, you availed of an opportunity to meet with some of my senior department officials only in the last few weeks to share your views on this matter. The meeting, which took place at the end of November, I'm told was constructive, and obviously will continue myself to engage with you on this matter, because it's absolutely essential that the health and safety and the well-being of, as I said, the men and women of Ólaigh na hÉireann is front and centre in everything that we do. I have received an initial brief from my officials on the matter of health and safety in the Air Corps. I expect to have a detailed report from them in Q1 of next year in relation to the matters that you've brought before the House. What this report will do will take due cognizance of the recent meeting that you had with officials, but of course as well the views of the State Claims Agency as they manage such litigation claims on my behalf. I also intend to seek the views of other stakeholders on what, if any, options may be open to me to pursue further to my receipt of this particular report. All that being said, I know the Deputy is very much aware of the fact that I'm limited in what I can say in relation to this in the House. I'm a defendant in several of the litigation cases that are on the way or underway at the moment and are being dealt with in the courts. I say that not to obviously avoid discussing it, but obviously as there is litigation, it's just important that I don't impede on that or don't infringe on that at all. Again, I know you'll appreciate it's an extremely complex matter. It requires very serious thought, engagement and deliberation. That's what my officials have been doing, and certainly that's something that I will focus on and prioritise as well.
Donnchadh Ó Laoghaire.
I suppose the reality that's there is that this is not an issue that has only arisen in Ireland. We know that in other jurisdictions, in Australia and the Netherlands, that exposure to very powerful, very strong and very dangerous potentially chemicals caused adverse health outcomes for personnel in those locations. In Australia, they took what I believe was a sensible approach. They evaluated the situation in terms of they had the SHOAMP, the study of health outcomes of aircraft maintenance personnel. They evaluated the situation and they offered health support. So I think that's key to what we do in relation to that. That is the kind of approach that makes sense. Evaluate the situation, try and identify the connections between the exposure and health impact, provide healthcare solutions and find out how it came to pass. This has been examined on a number of occasions in the past, although not all of it's in the public domain. We had the EEL Air Monitoring Report in '95, Forbert doing a report in '97, the HSA in 2015, but there's other documentation not public at this point in time. What I want to know from you at this point, Minister, is if you are open to doing something in addition to dealing with just individual cases as a category as a whole.
appreciate we might not be on our own in terms of other jurisdictions or where there have been issues similar that have arisen, and it is about going through the appropriate process and making sure that we're responding in the most appropriate way. Obviously, these matters are currently the subject of active and ongoing litigation, as I've mentioned. The HSA themselves have conducted several inspections in Baldonnel Aerodrome, and there's more detail in that regard that has been provided previously. But what I want to do now is make sure that the report that is being conducted and that has been put together, that I receive that report in Q1 as I've been given and been told that's the timeline. I'll then be able to make any decision on what future actions can be taken and whether or not there's something that can be done separate to the individual cases or the litigation that's ongoing at the moment. Ultimately, I want to support the men and women of Óglaigh na hÉireann. We want to make sure that we understand exactly what may or may not have happened here, and it's once I have that information, I think then we're all going to be able to decide what are the next appropriate steps and where will we take it from here. But I've been given that timeline. I'll work closely with my officials to make sure that we achieve that timeline.
I suppose just to re-emphasise the point, you're right. The men and women of the Defence Forces are the greatest asset to it. But just, I think the weight of this, needs to be emphasised. The Air Corps Chemical Exposure Group, ACCAS, have identified what they believe to be 110 untimely deaths. They've used that language advisedly because obviously we need to prove the link in relation to that, but they have questions and concerns over that many deaths and many very serious illnesses. So that's the concern, and indeed in other jurisdictions there was a connection between the chemical exposure and serious illness, because in the Air Corps there was many instances that there was no protective equipment, that there was no masks and so on. I appreciate court cases have to happen, and the people have an entitlement to that. That did not stop in relation to the industrial schools in terms of Magdalen laundries. An approach being offered which offered redress and support and accountability to the category as a whole concurrently. So I would encourage you to talk to the departments in question, indeed you were in one of those departments yourself, about how that was approached, that you can have your court cases, which people are entitled to do, and that you have a redress system for the category as a whole.
At the outset, it's just to say to you that I will be treating this with the utmost seriousness and working closely with my officials. It's also important just to stress that these are cases that are to alleged past exposure of toxic chemicals. So just to be clear, I suppose that we're talking about issues that may have happened in the past, and just to reassure people in that regard. In terms of the HSA, and I mentioned obviously the inspection that took place, they advised on a subsequent report in 24 that the Defence Forces had proactively rolled out training in the use of substance across the relevant personnel, and noted the evidence of compliance with the contravention notice. So it's important to point out where there have been inspections, where there's been engagement with the Defence Forces and where there have been changes, but as well as the report that I've mentioned, the tribunal as well of inquiry, which is due to start. There is power to investigate the response to complaints made regarding the use of hazardous chemicals within the Air Corps headquarters at the Casement Aerodrome. That's part of that as well, so there'll be an opportunity within the tribunal to be able to consider adequately any of the complaint processes that have been made in light of the responses that they received as well. So there's a number of different things happening at the moment, separate to the litigation, separate to the individual cases, the review and the report that's been done, and obviously there's another opportunity here throughout the inquiry for these types of concerns to be raised as well.